Actually, I want to start by thanking Bola for that fascinating presentation. I'd like to thank the organizers for giving me this opportunity to share with you our amazing, exciting, and very rewarding journey that we have taken working with families in the community in Singapore, with the preschool children that we work with in Singapore. So this is KK Women's and Children's Hospital. I come from the Department of Child Development, and most of what I talk about today is the work that we do from this department. This is the traditional model of care. Most of the intervention services are in the hospital, direct delivery by specialists, not much in the community, and certainly almost nothing in the preschool. Over the last 20 years, Singapore, KK Women's and Children's Hospital, and my Department of Child Development has really worked very hard to invert this triangle so that hospital services are the top, much smaller than what we do in the community. Certainly now there is much more in the community and with the family, and we are now beginning to provide intervention within the preschools. This is, of course, the natural environment of the child. And the advantage of this is that the child very quickly learns to generalize the skills that they learned so that they use it in their day-to-day interaction with their friends, with their families, with play, and with learning. The other advantage is that the teacher is watching, learning, and is being taught how to continue the intervention for that particular child, and more importantly, how to use the skills that they have newly learned with the next child, and the next child, and the next child who comes in with developmental problems. Of course, the parents are delighted because not only do they learn what to do, but they are spared from this perennial problem of having to take leave to bring the child for intervention. So the key to this is to collaborate. Collaborate, 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 and then collaborate some more. And we do this. Why? Because there are so many people who are involved in the life of the child. And as a single provider, we cannot be there all the time. We cannot do everything. We must involve all the stakeholders. So we collaborate. We collaborate with the government and with government organizations. We collaborate with volunteer welfare organizations that provide intervention. And we collaborate with generous philanthropy organizations that fund us for our projects. In all of this, we need to keep in mind that as we involve other people in the provision of services, training is really important. The capacity and the capability of the provider is our responsibility. And so we use a coaching modality. In Singapore, every 5 years, the government commissions the Enabling Master Plan. And the third Enabling Master Plan just came out this year. And this guides us for the next 5 years as to how we should be moving forward. So let me start with how we engage families. And I'm going to talk about the programs that we have and some of the pilots that we are actually doing. I don't have to talk about family-centered practice. We've had a wonderful presentation on this. The first initiative is the Singapore's Health Book. This is developed collaboratively with all involved medical institutions and is given to all newborns in Singapore. And what I want to highlight are the developmental pages. There are 7 developmental pages in this health book in 4 developmental domains, and it is based on the locally normed Denver Developmental Tool. In it are also every single red flag for autism. I never called it the red flag for autism because that will make parents very upset, but they're all there. Recently, this health book and the developmental pages were studied, and it was published in the Journal of Developmental Pediatrics. And we found that beyond 3 months to 18 months, 60 to 70% of parents had filled up at least one milestone in each domain. And 40 to 50% of them had all their domains filled up. And even if they didn't fill up the domain, the majority of parents told us that they found the list useful and they referred to it often. The second initiative is the Child Development Program. This is a government-funded program that is run in the two main hospitals, KK Women's and Children's Hospital and the National University Hospital. This is a highly subsidized developmental program for preschool children. And KK Hospital is a larger hospital, and we see 75% of the national cohort. In my department that runs this program, we have the full range of services, and we're really very blessed to have this. So we have the developmental pediatricians, the nurses, social workers, psychologists, all the therapists, OT, PT, SLT. We have education, literacy experts, we have psychiatric services, and we do transition into primary school. We see about 3,000 new preschool children every year, and we provide about 13,000 intervention sessions per year. We believe that intervention always has to be with the parent, and we believe strongly that the parent is the main therapist. So every single intervention is associated with a home program. In trying to help parents to understand that it is that repetitiveness in the context of a responsive relationship with a trusted caregiver that makes the change in the brain. We invest a lot in caregiver training, and so for language, for example, we divide our parents into parents of pre-verbal children, children with early words, and children of talkers, and we provide them with caregiver training, how to influence their children's language. We do this also for literacy. And we have an international collaboration with Melbourne, the Parenting Research Centre, in a program called Signposts for Better Parenting. This is a parenting program for parents of children from 3 to 15 years of age, where these children have difficult behaviors related to their developmental delay or their intellectual disability, and it has been proven to be effective in Australia. We use a small group setting, 2 facilitators to 10 families, 5 weekly sessions of 2 to 2.5 hours. We provide lots of parent materials, and we try to keep the fees affordable by using government grants and philanthropic funding. Because this is a program that comes from Australia, we needed to build our local resources. So we have 3 Australian-trained certified trainers and 7 coaches. And we create community-level expertise by running facilitator training courses. So we have done 10 of these, and we have trained about 200 facilitators from 35 different local organizations. We also have trained about 1,000 of our own families, of parents who come to our own department. We have both qualitative and quantitative data to show that this has actually made an impact on families. Beyond Singapore, we have an ongoing collaboration with the Parenting Research Centre in Australia and research projects with Monash University. One of my social workers did her master's project on translating it to Malay, and this Malay version has just rolled out. One of my psychology PhD students is looking at how we can use this for teachers. We have translated it into Mandarin, and that will roll out soon. And we are certainly looking at the interest that is coming from outside of Singapore. The fourth is Casper. Casper stands for Caring and Sharing, Parents Ever Resilient. This is our parents support program, and it was started by parents. The group meets once a month, and one of our allied health professionals or medical staff will usually go in to talk to the parents about a topic that they choose. So those are the programs that we run. I want to talk now about the pilot programs that we do. In order to be effective, one needs to look at innovative models of care. And when you do this, you really have to pilot it, because you need to show the proof of concept. You need to make sure that the model works before you can roll it out to the community. So let me share with you some of our pilots. The first pilot is called KIDS. KIDS Integrated Developmental Service for children of 0 to 3. Temasek Care is a very generous philanthropic organization that funded this. We collaborated with a family service center in the community, and we provided comprehensive care, multi-layered in health and in social care support for vulnerable children, 0 to 3, and we recruited pregnant mothers. And so the program started in pregnancy, and we supported these families up to the age of 3. The Temasek Foundation, our funder, also funded a community center where parents could actually drop in and provide networking support. From this program, we found that 90% of these children had normal milestones at 12 months, compared to 60% in the control group. Their birth weights were higher because they had better nutrition and because there was less prematurity. Immunization rate was certainly higher. 80% of them were up to date compared to 60% in the control group. And the family outcome survey showed that parents had a far better understanding of what they could do for their children. This was the model, the pilot, and when we finished the pilot, this model was taken over by the government. The government gave it to an organization called the Early Childhood Developmental Agency, and they have renamed it Kickstart Project, and this project is now rolling out in 4 geographical areas of the country. The second pilot that we are running is called the SAFE Project, and SAFE stands for Supporting Autism Through Family Empowerment. This is a parent-mediated, home-based, routine-centered program to support families of children with autism by giving them knowledge of autism and skills. The primary caregivers are facilitated to problem solve and to manage the resources to manage their child in their daily routines. This program is run by a family service coordinator who educates the caregiver, facilitates the problem solving, and mediates the generalization of skills. And they use this approach called questions to actions. What do the parents want to do? So they set goals. Why do they want to do this? So they understand why it's important, and where can they use these newfound skills? This helps parents to manage their information overload and helps them to move from what is important to what is relevant to what is practical for their family. The next is a project called SPACE. SPACE stands for Supporting Parenting with Anxious Childhood Emotions. We do not want to wait for children to develop anxiety. We pick up children with anxiety symptoms. For example, symptoms that interfere with daily functioning, they don't participate in group activities, and in school refusal. This is a collaboration with Yale's Child Study Center, and this program helps parents to support their anxious child, okay, not that child with anxiety, their anxious child, and to treat this without us working with the children. This is done through individualized parent-based intervention. Our psychologists have all been trained by the SPACE founder, Dr. Eli Leibowitz in Yale. There are 10 sessions per family, and parents learn about anxiety, how to support their child, how to communicate effectively, and how to create concrete plans. So those are the ways that we have engaged families. Some of them are still in the pilot stages. So we've talked about the programs and we've talked about our pilots. So let me talk about how we engage the community. 3 programs. First, the Developmental Support Program. This is a program where the intervention is done in the natural setting in the preschool.
Excuse me, 2 minutes.
Yes. We work on building capacity and capability in the caregiver and the parent, and it's about right-sighting, because 8 to 15% of these children have developmental problems. We collaborate with 10 organizations. We work in 3 phases. We introduce the program to the parents and the teachers, we screen the child, and then we provide the assessment. So first we have to engage the preschool. Who wants to do this? Then we created this role called the Learning Support Educator, who screens the child, provides the classroom support, and provides the intervention. Then we have to look for who's going to provide the intervention. So we collaborate with providers. We provide 2 intervention programs, a developmental support program with the psychologist, and we provide a learning support program mainly with behavior and social skills. And in the last 5 years, we have provided intervention to about 7,000 children. This has been a long journey from a very small project to what is now a government-based project that is rolling across the island. There have been numerous publications, and we now serve as the consultancy team that manages the project. And this project won the National Medical Excellence Award in 2015. In the EPIC consultancy program, we found that the early intervention programs in the community needed support. So we were then commissioned by the National Council of Social Services and the government to help these programs establish service standards and build capabilities. We use 6 stages of implementation.
I'm so sorry, Dr. Reynolds. Please wrap up.
Right. We have put in implementation drivers, and we have gone out into the community to work with other ministries. So here we've talked about how we've engaged families, how we engage communities. Thank you very much. This is my last slide on the key messages that I have shown today. Thank you very much.